Hello, everybody. Welcome back, or welcome if this is your first time visiting. This is Tina Hurley, founder and CEO of Less Leg, More Heart, one of the charities that helps amputees in the country. We are really excited because this is the first meeting of 2023, and this Heart to Heart series was a big hit last year. We bring health and wellness experts to you guys in the comfort of your own home to basically promote education, inspiration, collaboration, and perspective, a safe place that people can come and congregate to learn about things related to the amputee journey, whether that be mental, physical, social, or economic. Prosthetics to mental health to medicinal cannabis. I mean, really no stone is unturned throughout the year. We have wonderful speakers that come on, and we do have a registration that you guys can get to on our website under the About tab. You can go into Heart to Heart and just put your information in for free. It just allows for us to get your email so that we can keep you up to date on all the new speakers that are coming every month, every second Thursday of the month at 6 p.m. Eastern, with the same Zoom link for your convenience. So as we talked about earlier in other segments, we are really blessed that we have some good friends that know a lot of information. And today's topic in particular is one that I've gotten a lot of questions about, that I was undereducated about myself, starting this journey of pain and trauma, and that I was lucky enough to have a former colleague of mine, Lisa, nearby to help educate me. And I thought, what a beautiful opportunity to bring that to our community to answer some questions and shed some light on some great areas. So if you guys don't know or you haven't seen the information, Lisa, who's here today, is a certified nurse practitioner. She has a degree focus in palliative medicine. She specializes in complex symptom management for chronic illnesses and life-threatening diseases. She's certified in palliative care. She has several decades of experience in the medical field, and she is one of the folks that understands more than most about the increasing complexities of that patients and families will actually experience in what we know to be a very confusing and rocky medical landscape. So she has an emphasis in her practice on listening to people, understanding their journey, and living with the effects of our serious issues and chronic disabilities. So obviously that fits perfect with us. And without further ado, I would love to welcome Lisa here and have her share her topic, which is medicinal cannabis.
First of all, I didn't know it was going to be recorded. I would have prettied myself up, or is it just recording like voice?
No one's looking at you. That bookshelf is too pretty.
Yeah. And just for everyone, this is not. This is a backdrop. We're doing some reconstruction in this room, and I had bags of stuff, and I tried to put it places, so I wanted it to look a little bit prettier. So this is one of those fake backdrops. So this is not my fancy home. So I guess I wanted to start. I have a little bit of a presentation, but usually I like to start with questions that you may have about cannabis. Because I want to make sure that we have time to kind of address the reason you came to the meeting and anything in particular you wanted to know. And if it's something that I have in my presentation, I will just kind of say, I'll answer it quickly, and we'll go over that in a little more detail in a little bit. So is there anyone, Tina, hopefully you can do it if people raise their hands or just unmute themselves. But
yeah, you guys, there is a raise a hand function on Zoom at the bottom of the screen. So you're welcome to either hit that or just send a message in chat, and Lisa or I at any point can moderate that. But I will start, Lisa, just so that people feel they have a second to think. I know the main questions that I had when I had first started was, is CBD the same as THC? Does one do something different than the other? Is there like a dose effect? Are there differences between the different ways that they're administered? Are there any reasons that it would be contraindicated, like the reasons that people shouldn't take it? And just safety, right? Like some of the legality behind it. Those were my big questions in the beginning.
Okay, so now that's a lot to go through in 30 minutes, girlfriend. You
can take whatever you think's important.
I'll do my best. In my presentation, I just have PowerPoint slides that kind of keep you focused. We do talk a little bit about that. I guess what I'll do probably better, unless someone has a question, another question. I'll start with that, and feel free to ask questions along the way. I'm not good with this technological thing, so if someone can monitor chat and let me know if there's a question, that's great, because I don't even know where to get to it. Okay. All right, so first thing, we practice this. Let me see if I can do it again. Share my screen. Hold on. All right, let me move this over. All right, so is it shared?
Yes.
Yes? Okay. Oh my goodness. My dog is underneath me trying to get in on the action with this one. All right, so we're going to talk a little bit to answer one of Tina's first questions. Well, actually, this goes beyond that. Let's start with cannabis. There's different types of cannabis plants, okay? And again, I don't know where everyone who is present tonight, where you live. So a lot of times you have in other states, states that have had cannabis for a lot longer, they know a lot about this stuff. So what I want to do is just go basic. So you hear people talk about cannabis strains. By strains, what I mean is type of cannabis plant. Okay, so just like there's different types of tomato plants, there's different types of cannabis plants. Sativa tends to energize, helps you focus. Can we see this? Oh, it's not letting me point. Helps you focus. It helps with nausea, GI upset. You know, sativa is good. A lot of people use it for antidepressant properties, use it for migraines and nausea, okay, and increase energy. Then there's indica. Many patients have nicknamed that indicouch. It just kind of settles things down. It tends to be a little more sedating. So most people use indica at nighttime and sativa in the daytime. Okay. Then you have what's called hybrids. Basic biology is with a hybrid is where they breed a sativa with an indica. Most cannabis nowadays is some kind of hybrid. It is, I don't want to say rare, but it's the pure sativa or pure indica they occur less often. It's mostly hybrids. So you'll also hear, and I've written over here on the left with the cannabis strains, the type of plant, those are called cultivars. Okay, so that's sativa, indica, and hybrid. So now that we've talked about that, I will tell you, at least in New Hampshire, where I am, the dispensaries are starting to get away from sativa, indica, and hybrid, and they're calling it daytime, nighttime, and anytime. And the reason they're getting away from that is the effect of what you're using, the cannabis that you're using, really has more to do with what's in the plant instead of the type of plant that it is. Okay. So let's see if I can go forward. All right. So within the plant, there are hundreds of compounds, of which probably about 120-ish are called cannabinoids. What I've done on this next slide, okay, these are the two most well-known cannabinoids, THC and CBD. So this is starting to answer Tina's question about, you know, the differences and that kind of stuff. So at the top here, we talk about THC. THC is the psychogenic component, so what causes the high cannabis is known for. It's really good for tightness and stiffness and spasms, and THC will help you sleep, okay? Also good for appetite stimulant for those with cancer or those with issues with that. If you get too much THC though, THC is what makes you squirrely. All right, and by squirrely, I mean anxious, paranoid, heart pounding, skin crawling, that kind of stuff. So I tell people who've never tried it before, part of your guinea pig phase is figuring out how much THC you're able to tolerate without setting off those negative symptoms. CBD down at the bottom slide, CBD is non-psychogenic. Okay, a lot of people say psychoactive is like psychogenic, but on this slide, what I will say, it is psychoactive because CBD interacts with the serotonin pathway, but it's not psychogenic like THC is. So that's a big difference. Okay, CBD again does activate the serotonin pathway. It can calm the high of THC and some of the negative effects. CBD has a big anti-inflammatory component without that gut rotting component like the ibuprofens. Also very neuroprotective. So the neuropathic pain, the phantom limb pain, neuropathies, neuralgias, people with migraines and people with seizures tend to do very well with what we call CBD rich cannabis, which just means there's more CBD than THC. Another cannabinoid, and it's certainly not new, but we are starting to see the dispensaries really start to use more of the CBG or have more options with CBG. CBG is hugely anti-inflammatory, good for all kinds of things. Many of the cancer patients are now looking for CBG in huge amounts. There have been recent studies out that show not only does CBG stop tumor growth, but it actually decreases tumor size. So, again, that's only a few studies that have done that, but now many of the oncology patients are looking for CBG as part of their treatment plan. This little wheel is just really kind of a visual. And I'm happy to share these, Tina, if you need to send it to other people. I can send the slides in like a PDF. But this just tells some, certainly not all of the cannabinoids, but it talks about some of the cannabinoids and what people feel they're useful for. There's something called the entourage effect. I don't know, some of you may have heard of that. The entourage effect essentially is they work better together. They work synergistically with each other, the cannabinoids. I talk about it. I like to simply put the entourage effect is the benefit you get from ingesting multiple components of the cannabis plant together instead of just one component at a time. So usually there are some people who might find CBD only helpful. So it's like CBD isolate, CBD by itself. More often than not, though, it's more effective the more cannabinoids that are in with it. So that's the entourage effect. So it works better together, that synergistic effect. Are you monitoring the questions, Tina?
Yes, I'm on it.
So along with the compounds, the cannabinoids, there are terpenes. And I like to kind of describe the terpenes kind of like, the aromatherapy. That's exactly what terpenes are. There are many different kinds of them. When I went to a terpene class done by one of the dispensaries here in New Hampshire, one of the things that they recommend if you're using cannabis, is to smell it. And if you smell it and you're like, oh, it's making me gag, it's disgusting, that's your body's way of saying that's probably not what you need. But if you smell one and you're like, oh, that smells good, that's probably going to work better for you than the one that doesn't smell good for you. Sounds kind of weird, but it's aromatherapy and many, many different kinds of things. I have two, maybe three slides that go into detail for the terpenes. I'm not going to take the time up here. Again, I'll send the PDF so you have them. I feel that they're good references for you to have, especially if where you are, you're using cannabis. And again, to start looking at labels, at least here in New Hampshire, that not only label the THC and CBD and the cannabinoids, but in New Hampshire, they also label the terpenes. And the cannabinoids and the terpenes are what you really want to look at when you're trying to find something to help the symptom that you're looking for help with, if that makes sense. This is another visual. And I will say, just for sake that you have some increased information, this one here, caryophyllene, the one that's on the right, the beta caryophyllene is what the drug dogs are taught to smell. So it's not just, oh, they're going to smell cannabis. It's the beta caryophyllene. Okay, I guess it has a stronger smell to it. So
That's interesting.
yeah. All right, so here, so when we talked about the cultivars, okay, those were the types of plant. The chemovars, all right, and I'm just trying to give you lingo. Sometimes it makes your head spin, and I try to put it in different ways. But the chemovars are those crazy street names that you hear. Okay, so I put some of them here. The ones I put here were there for the purposes of presentations, because they're not some of the real. Some of them are swear words. But the Granddaddy Purple and the Blue Dream, anything, most of the anything purple or blue, that's going to help with PTSD and anxiety. You've got Sour Kush, AC/DC, and Headband. The AC/DC and Headband usually help with migraines and neuropathic pain. Super Lemon Haze and Northern Lights, and so just know that the street names like these are called chemovars, and they are based on not necessarily the strain Sativa indica, but they're based on the cannabinoid and the terpene and the flavonoid content. It's hard for me to do this presentation because I can't see people nodding.
The virtual world there's so many benefits.
I'm used to being in a room. Yeah.
Yeah, but people can come that aren't in close proximity, so it's so wonderful. But I know what you say. Like, you make a joke and everyone's laughing, but you can't hear it.
I can't see it, and you're just kind of like, okay, we're just going to move on. All right. So this one I put in here really for the medical world, and there's people that compare cannabis to opioids, and opioid has that respiratory depression. You can have that cardiopulmonary failure with that. So what you need to understand, cannabis doesn't have that. Okay, there's very few cannabinoid receptors in the brainstem. The brainstem is what controls the respiration and the cardiac function. So you don't have that cardiorespiratory failure with cannabis like you find with opioids. So going to more of what Tina was asking, and I swear I didn't share the presentation with her before. I'm just have something in my presentation.
Great minds. How does it go? Great minds something?
What's that?
It's a great minds something?
Right, that's right. All right, so lots of different ways you can take cannabis, more than this list. The inhalation methods, those kick in quick but drop off quick. That includes smoking and vaping. You hear people say dabs and that kind of thing. That's all the inhalation methods. Tinctures, the topicals, the salves, the sprays. Some of the sprays are sublingual though. Capsules, patches, edibles, lots of different kinds of edibles, drinks, and suppositories. So just a little reference here. And again, these are kind of ishy, I call it. So it talks a little bit about some of the different delivery methods and how long it takes for them to kick in and for how long they might last. And I find that a good frame of reference. There are many people who have chronic pain. And like if you're taking opioids, excuse me, they may have like a long-acting opioid and a short-acting opioid. So if you convert that to cannabis, the long-acting is going to be ingestion or the edibles, because they take longer to kick in and they last much longer. And then the inhalation methods, smoking and vaping, and like the tinctures, are going to be the short-acting. Okay, so that's what you're going to use for breakthrough. I have had people who say before they go to bed, okay, they're really in a lot of pain. And so they might smoke or vape at the same time that they take an edible or a capsule. And that is usually safe to do because the inhalation methods kicks in quick. And as that is dropping off, the edible is kicking in. So it kind of covers it until the long acting can kick in. And I just, different ways to take it orally. The tinctures are the drops, the Rick Simpson oil, Those are the Rick Simpson oil some people cook with. A lot of Rick Simpson oil is something that many of the oncology patients are looking for. They're using that instead of chemotherapy. Not that that has been, approved or anything like that, but there are what we call Rick Simpson protocols for that. Topicals, lots of different ways, salves, lotions, oils, sprays, and the transdermal patches. The enteral, that's edibles. I mean, lots of different ways you can take those too. The capsules. Capsules, many people who like maybe try to take the tinctures and it just doesn't work for them. The capsules, what they do is they kind of bypass the stomach. And so the capsules take longer to kick in. They're kind of like an edible. Because it doesn't start breaking down and you don't start getting it until it bypasses the stomach, until it goes through the stomach. Suppositories, I know a lot of people go, ew, who would use that? Both rectal and vaginal suppositories. I have lots of patients who use these, some with different kinds of GI pain, some with endometriosis, cancer, that kind of stuff. So and the what happened here? The suppositories usually kick in faster. And this one I'm going to bypass. I had slides for the New Hampshire Therapeutic Cannabis Program, but that's before I knew that not all of you were from New Hampshire. So now I guess we'll open it up to questions. Let me see if I can unshare and figure out how to do that. Hold on. That do it?
Yay, you did it. Thank you so much for sharing that. I know that you had provided a pamphlet when I had seen you, and just it blew my mind. I, as a Western clinician, we're not taught any of this stuff, and I didn't have options. I just wanted to know more information so I could make educated decisions and be able to help other people advocate for what was best for them, whether it was pharmacologic or more, homeopathic or holistic, and knowledge is power. So, as Lisa mentioned, we would not have time or resource really to sit here and go through all of the state specific regulations and guidelines.
Right.
As you guys know, cannabis is a hot topic right now. I mean, CBD is one of the biggest consumer products in the world right now. And there's a lot of bad stuff out there because a lot of it's not regulated by the FDA. So the reason that it's sometimes helpful to find a cannabis prescriber, if it's lawful in your state, is that they can get you to dispensaries where things are actually tested and you're getting what they say they're giving you, and those things are, at least the products are scanned rather than what you just buy online. So right,
you want to know what you're getting. You really want to know what you're getting. And cannabis nowadays is very different than back in the day. Okay, when you just kind of used it more in what I'll call like a Cheech and Chong's or like a Woodstock manner. Can it be used that way still? Sure. But the people who are coming to me are not looking for that. They want to feel better. Cannabis today is stronger than it used to be. We know a lot more about it. But if you know, it's bred for specific things. So if you know what you're looking for, it can really bring some benefit.
Anthony, you had your hand up a bit ago, and I absolutely just forgot. Did she address your question, or do you still have one? Yeah, you're muted, hon.
Sorry.
There we go.
Figured things out. Completely spaced on the question that I was going to ask. It's all good though.
Sorry. If it comes back up, let me know. Sorry about that. Just blurt right in. I wanted to mention there are all these different kinds of apps. Right now the technology is wild, and what helped me to learn some more too was to find. So you talked about what's the name for the strain types, or the
chemobars.
Yep, I'm trying to nail those terms down. You can go into apps. There are apps like Leafly.
Leafly is the one that I recommend.
Yeah, and that is wild.
Yeah, and if you don't have a smartphone, or you don't like to download app, and it's free, you can also access Leafly just online. But it really gets into if you're serious about using cannabis to help with your symptoms, it really would do you good to learn about the cannabinoids and the terpenes, because depending on what you want to take it for, daytime versus nighttime, for energy, but then you want to take something for sleep. You may take something, say, for anxiety in the daytime and a different one for anxiety at nighttime, because you want to be able to relax more. And so you're going to get into the cannabinoids and the terpenes, and it truly, when you start doing that, it's fascinating stuff.
Wow. When we had gone through that slide, so there's this, and just for reference, each state that you can purchase marijuana in for medical reasons or recreational reasons, but for medical reasons, at least in New Hampshire, Lisa's business Palliativity has this sort of printout of what the New Hampshire guidelines say. So for you to get a license, it's called license, to have medicinal marijuana card here in New Hampshire, you have to have, and I'll read this so you guys understand kind of at least here what meets the inclusion criteria. You must have a medical condition and a symptom as follows. So either ALS, immunodeficiency syndromes, Alzheimer's, ALS, cancer, chronic pancreatitis, Crohn's disease, Ehlers-Danlos syndrome.
So let me show that real quick.
Oh, do you have that?
Yeah.
It's
Yeah,
all
I
these
have
different
not the
guidelines.
one that you're showing, but let me see.
And
I got
you
like
know,
these 3 things up. I don't know what's going on here. Hold on.
and for our
Just have to
population
bear with
of
me,
people,
guys.
no, you're good. For our
Here
population
it
of
is.
people,
So
the
this slide
pain,
right here.
and show the pain part there, like the specific pain ones there.
Right. So if you see, I'm trying to use a pointer, and is it over here?
I
can't
can
use
see your cursor.
Oh, hold on.
Yeah, there you
So
go.
this here is what we fill out. You see the top section A under patient's name?
Yeah.
Those are the conditions. Okay, and that's what Tina was just starting to talk about. So in New Hampshire, and this is where I really think we need uniformity state by across the country, access for patients as well as certifying conditions. So in New Hampshire, you have to have at least one in box A and the one that's in below it. So we have AIDS, Alzheimer's, ALS, cancer, chronic pancreatitis, Crohn's, Ehlers-Danlos, epilepsy, glaucoma, hepatitis C, lupus, MS, muscular dystrophy, Parkinson's, HIV, spinal cord injury, disease, traumatic brain injury, or ulcerative colitis. We do have that one that says one or more injuries or conditions, okay, that results in, if you look at the box underneath it, so you have to have a box checked in each section. So, agitation of Alzheimer's, cachexia, the weight loss, chemotherapy-induced anorexia, constant or severe nausea, the elevated intraocular pressure, moderate to severe insomnia, vomiting, seizures, severe pain that has not responded to other things. We're in the process of changing that, actually. Severe persistent muscle spasm and wasting syndrome. All right, so you have to have one in the top, because if you have insomnia, but it's not caused by one of the things that's at the top, they won't let us certify in New Hampshire. Okay, so, again, we need uniformity across the states. This bottom one where it says or section B, that's the condition only. So we have autism spectrum disorder. This one is relatively new in New Hampshire. We have different regulations for 21 and older or under 21. PTSD, chronic pain. And again, they've got severe pain that has not responded. Again, we're in the process of changing that. So those in that bottom section can stand alone. Other states, it differs state by state by state. And so, to me, it's time to really get uniformity as far as certified conditions, as far as how much a patient is allowed to have of cannabis, as far as what the some states require patients to go through an educational program in order to get certified for cannabis. So let me unshare my screen. So then, sorry.
That's great. No, that's great, because I know when I was looking into all this, it was like, what allows for someone to be a reasonable candidate for something like this? And I guess my question to you, Lisa, too, was, have you found significant success in decreased utilization of narcotic needs for patients that are utilizing cannabis, or does it go hand in hand, or what's your experience there?
I actually have had patients peel off all kinds of medication. I mean, some patients still stay on medication, but most of them have been able to decrease their dose. I've seen patients decrease opioids, the benzos, the Xanax, the lorazepam, the clonazepam, muscle relaxers, and psychotropics. Once they find, once we get them, once we figure out their cannabis regimen, they've been able to really peel off other medications, pharmaceuticals. Yep.
And what about traveling? Because I know that, federally it's not legal, but state-wise it is. And I know one of my friends is a federal officer in DC, and he works on federal property in the center of downtown Maryland, where it is recreationally legal. But when you're on federal land, where the monuments are,
yeah,
it's still in the state where it's legal recreationally, but you still can get arrested when you're so confusing. But all that to say that when you're traveling and you have this as your primary, I'm using the word medication, but your primary regimen of pain treatment, I bet people are terrified to travel for the risk of getting in trouble.
they are, and that's kind of a touchy subject. That's one of my number one asked questions. And not to beat around the bush, but my honest answer is I can't really tell you. But I expound on that with patients and tell them technically it's federally illegal. All right. When I have traveled, I have asked lately, TSA, what do you do? I'm a nurse practitioner. I certify patients for cannabis. What do you do when they travel? Because, it's not just flying, it's traveling by car or, however you want to get there, and international travel and that. And what some of them tell me is federally illegal, blah, 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 they'll get arrested. What most of the TSA people have shared with me is they are looking for, if you've ever watched those shows like Border Crossing and that kind of stuff, they're looking for those peeps. All right. They're looking for the people who are trafficking it, hiding it in the lining of their stuff. What most of them go by is the legality of cannabis in the state you're flying out of and into. Okay. And there's always police, for that state or city at the airport. And what the TSA said is if there's ever a question, they just call the police. Most of the time, it just gets taken and thrown away. Certainly if they're traveling with, way too much of it, whatever happens to be in that state, and they don't have a card, then that might be a problem, but rarely do they get arrested. Most of the time, if they're not going to let you take it with you, because sometimes they do, they'll throw it away.
Mm-hmm.
But that doesn't help people who have gone off medication and are comfortable on cannabinoids, and now they're
being
going
prescribed a narcotic for bridge. Yeah,
I've had to do that before, unfortunately. People going on vacation and they're afraid to travel with it, so I have to put them on a small amount of opioids, or just because I'd rather them have it and not need it than need it and have an uncomfortable vacation.
Right. Now I could ramble off questions because I think this is a hot topic and a lot of folks ask me stuff, but I really want to utilize some of this time for you guys to ask anything, share a story related to this. Why you felt compelled to be here. Is there a topic of interest that we can have a discussion about, or share experiences about? Please chime in. I'm just going to go silent to see. I know that Anthony, you know a bit about this subject, and so if there was anything that you felt either to highlight or reiterate, or anything that struck a chord with you, or maybe that we didn't talk about, your input would also be very valued. But also no pressure if we covered everything thoroughly, because we tend to, right, Lisa?
Right.
No questions.
Everyone's so quiet.
I know.
And okay.
Yeah.
Okay. And you guys stay with, what is that, New Jersey? So you
New
guys,
Hampshire.
New
What?
Hampshire, you could only
can't
buy
hear him.
marijuana through, if you had a card?
Yeah, so it's illegal in our state unless you have a medical card for
okay.
it. Like you have the medical indications and then you have recreational, and those are two different, maybe you can speak to that, Lisa, how those are different sort of topics, the medical versus recreational.
But you can
Right.
go to the store and buy recreational.
Not in our state, you can't.
Okay.
So Craig,
okay.
where do you live?
I live in Seattle, Washington, state of Washington.
Oh, yeah,
Yeah,
okay.
we've been a little bit
So-
ahead of you guys for a long time, man. What, 2012, I'm looking
So
at.
New Hampshire only has a medical program. It is not, we have tried to pass what they call it the adult use, not recreational. We have
Mhm.
tried to pass that for a number of years. We're hopeful it'll go through this year. But in New Hampshire, the therapeutic cannabis program is medicinal only.
Wow.
So, yeah, and that's a whole nother thing too. And I don't see uniformity across state lines in that until the federal government pulls it out of a Schedule 1. You know, right now, I'm sure everyone on this call knows, the DEA has cannabis in what's called a Schedule 1. It's in the same category with heroin and LSD.
Mhm.
It is when it's in a Schedule 1, what that means is it's highly addictive, which is not true. It means that it's very dangerous, which is again not necessarily true. And there's no medicinal merit, which that's really not true.
Mhm.
If you look at the fact that the government actually owns a patent on some of the cannabinoids for the medicinal merit, then, you know, it just helped me have that make sense. You know, I'm not going to get into that in this Zoom, but, you know, there is a patent out there by the government for some of the medicinal merits of some of the cannabinoids.
I did not know that.
Wow.
I
But it
think
doesn't
it's,
surprise me. I mean,
think, now
Doesn't
don't,
surprise me. Think
don't-
about the food pyramid and all that.
don't quote me, but I think it's patent number 6631507 if you want to look it up.
Oh, can you give that to me? I'm going to drop it in the chat for everybody.
I could be wrong here, but I'm pretty sure. You Google government patent on cannabis, and you'll find it's there. There is a patent that they've had for years
Wow.
on it.
Conspiracy. But also I wanted to mention too, while you were talking about that, I didn't know, but when you get a card for medicinal marijuana in some states, there's something called reciprocity, which is a fun word to say, but also it means that some states that border other states will allow acceptance of the medical card. So for instance, if you have one here in New Hampshire, you can go to Maine and use their dispensaries with your medical card, but you wouldn't be able to go to Massachusetts per se, just because they don't have reciprocity, or they didn't when I last checked.
Right, they don't, unless it happened yesterday.
Yeah, so
my patients keep me in the loop on that, but
and the reason that I think it's helpful is because sometimes it's cheaper. Like when people have a medicinal card, I know a lot of people that have chronic illness in any form, you know, you're always trying to save money so that you can pay for the drugs that you need, whether these are holistic ones like, you know, cannabis, or they're pharmacologics, you know. So if you go to different states, like Maine is a lot cheaper than New Hampshire. So it might be good if someone is covered and gets a card in their state to consider the prices of the states that may be drivable to them for cost savings.
Right. And that's a whole nother reason too, at least with the medical program, we need reciprocity, we need uniformity. Eric has had his hand up for a while, I think.
Oh, what a gentleman. Sorry, Eric, go ahead, jump in. Eric, if you can hear us, just unmute yourself and come out of orbit. Oh, there he is.
Or maybe it's
Yeah,
like
I've had a little
high-fiving,
bit
I
of
don't know.
experience with medical marijuana. I used to live in California, and you could have it delivered to your house quicker than you could have a pizza delivered to your house. And if you go on Weed Maps and you're in a, if you're in a state which allows it, you can go on a thing called Weed Maps, and it'll show you all the dispensaries that are around you and delivery services. And also, edibles are usually available, and that's processed differently than smoking it. It's processed through your liver, and it's a different type of high. And a
Right.
lot of people aren't ready for it. Instead of taking like a quarter of a brownie or a quarter of a treat or a whole gummy bear, they'll just ingest what they would regularly, as a treat that's undosed with THC, and it'll send them on a kind of a it could be unpleasant. It could get you too high, basically.
Right.
And go ahead.
So I want to comment on that, and thank you for bringing that up. I didn't have enough time tonight to get into every last little piece of it, but edibles, it takes longer to kick in for that reason, because they have what they call first pass through the liver. It has to go through the liver first, and then once it kicks in, it is there for a while. And so how I educate patients, and I try to keep things light, but my patients know that you have to take heed, and they leave my office with instructions in that. But if you're going to use an edible, especially if you've never used cannabis, even if you have smoked cannabis and stuff, it's going to hit you differently. You say you want this cookie, what we're going to tell you is cut it in quarter pieces or smaller, and take just one piece and wait 2 hours. If you feel no effect after 2 hours, then take just one more small little tiny piece and wait 2 hours. So it's one piece, 2 hours, one piece, 2 hours. All right. The people who get into trouble with edibles, all right, are one piece in it every 5 or 10 minutes, because they're like, oh, it's not working, not working, not working. And then by the time 2 hours rolls around, they've had maybe a couple of fistfuls of cookies or like half a sheet of brownies. And then by the time it kicks in, you're like, holy moly, wow. Right. And so then it is too much, because you're high, you can get anxious, you can be heart pounding, skin crawly, that kind of stuff. The one thing I can tell you that I don't think I mentioned in total detail when I had my slides up, if ever you're using a cannabis product, all right, even if you've used it for years, if ever you're using a cannabis product and you start to get the heaves from it, you're starting the skin crawly feeling, you can actually take some CBD. I recommend tincture, the drops. It doesn't have THC in it, and it should settle those side effects down. Okay, so if ever you all of a sudden realize, oh my goodness, I've had too much cannabis and it's too much THC, take some CBD, and it should just squelch down those side effects.
Cindy, you had a question. Did you want to ask Lisa?
So just out of curiosity, if you had not that I do, but if you had a license in Mass, because that's where we are, Cole and me, if we had a license in Mass, does that allow you to go into Vermont or New Hampshire or Maine to buy or legally?
Maine has reciprocity, yes. New Hampshire has it on the books. I'm not sure if you could go into a dispensary. Right now in New Hampshire, the dispensaries systems don't speak to each other. So there was concern. So it is on the books, New Hampshire has reciprocity, but I'm not sure you could go into a dispensary from another state right now. Vermont, I believe, does have reciprocity. So yes, you could. Maine, I know, definitely does. You can, if you have a medical card from another state, you can go to the medical dispensaries in Maine.
But from what I
Now-
understand too, there's only like a handful of dispensaries in New Hampshire, right? There's like less
There's
than
7.
yeah. So
7.
you could, I guess, Cindy, maybe.
Listen, stop laughing, Craig. Okay, and Eric, I'm sure you're rolling your eyes too. Stop
I don't
it.
know what's
Let me
going
tell
on
you.
with the East Coast over
You
there.
could- you
Oh
could
my
call
God.
Cindy. You could call
Let
and
me
maybe ask
let me
them.
tell you, on Massachusetts, there is a dispensary every 5 miles.
I know, but that's because you guys are also recreational. We're not. New Hampshire just
They're popping up. You know how many banks you have? Those dispensaries are popping up as many banks. That's how many dispensaries. I'm like, oh my
You
God,
wanna
there's
know-
another one.
Do you
There's
want to know what
another
I think
one.
is the craziest? Is that our state slogan is "Live free
Live
or
free or
die."
Free or die. Yeah.
you don't know how many times a day, a week, a month I hear that from patients. And you know what I can say, the program started 6-7 years ago now, and we have made strides. When I start feeling frustrated over, how come we're not here yet? How come we're not here? There's only so much we can do. I mean, it's very political, as you guys know. But when I start getting frustrated, I do look back over the last 6 or 7 years. We've added more certifying conditions. We've taken away. New Hampshire used to have it when it first started, where you had to know the patient for at least 3 months before you certified. Meaning a patient, I would see a patient and then have to tell them to come back in 3 months, and then I could certify them. When I could, not that I would, but I could order opioids for them on the first visit, but for cannabis, they have to wait 3 months. That's gone. So, at least there's that. So, it's baby steps, sometimes smaller baby steps than I want it to be. But when you look back as a whole, we're making strides. But they're not going to. There's specific regulations for the number of medical dispensaries that are allowed to be in New Hampshire. And right now, I think there's one more allowed. Okay. And they're trying to come up with a strategic place, up near Canada and that kind of stuff. But I mean, I know, Craig, you laugh, and sometimes I do too. When patients move here from other states, say, stay out in Washington or California or Colorado, and they want to get certified, and certainly I certify them, but the first thing I say to them, and our dispensaries, they're doing the best they can with the regulations that they have, or what I'm going to say. The first thing I say is, understand this dispensary is not going to be like the ones you're used to. And I've never even been into a dispensary in Colorado or whatever. I've seen pictures of them. We're not allowed to put pictures of the inside of dispensaries online anywhere. Okay, so it's just, and that's part of what I talk about as far as uniformity. We need uniformity. What's allowed, how much you're allowed to have, like state to state. New Hampshire, the patients are allowed 2 ounces every 10 days. Okay, some states think that's a lot. Okay, some states are like, are you totally kidding me? We get 10. And I think New York, they just recreationalize it, and correct me if I'm wrong, they get a pound. Right? Tina laughed, but it truly, look it up, it is a pound.
It's not very good stuff. It's all garbage over there anyway.
Right, but they're allowed a pound. Not that everyone needs a pound, mind you. I mean, that's more than most people need at one time. But when you go from, oh, you're allowed to have, some of the other states, they only have flour, or they only have edibles. A lot of states don't want edibles because they appeal to children. And we just need uniformity. People need to be able to travel, and if they're using cannabis to manage your symptoms, to not have to worry about bringing it all with you, but you can just stop and get somewhere you're going.
Yeah, I totally feel that. Does anybody have any last questions for Lisa? We're getting close to the time. I want to be respectful of all of your time. Anybody else last questions?
I don't have a question, by observation. I think I'm gonna have to get my money together. So when you guys do allow the dispensaries, it'll be a good market to get in on, because good grief, 7, 8 dispensaries in California, Oregon, and Washington, man. They're just full of them. So,
And
Well, New
it's cheap
And
out there,
Massachusetts.
from what I understand it.
mhm,
It's
Mhm.
cheap out there.
yeah. yeah.
Well, I want to send thanks and love to everybody for spending your evening with us, getting educated and showing up. We do have another meeting. It's every month. So next meeting is going to be on the 9th of February. We have Dr. Amy Novotny coming back from PABR Institute, and she's going to be talking about calming the nervous system to cope with stress. She does a lot of breathing techniques and has a lot of incredible knowledge about stress reduction, pain reduction, and neural de-escalation. So you won't want to miss that one. If you are registered through our website, you will automatically get email reminders. It will be the same link, same time, 6 p.m. Eastern. But Lisa, I can't thank you enough for giving us your time and your talent and your knowledge. This information is going to be widely useful, not just to the folks that are here, but also when we disseminate it on our social platforms for people to just feel like they have some tools in their tool belt to just advocate and know the lingo, as you had mentioned. So thank you for helping fight the good fight against people not getting what they need to feel well, and also being an advocate for patients in the system, helping to create some of the changes to positively benefit patients. It's really admirable what you do.
And you're very welcome. And I will say that I think some of the people, oh, look at that pop. Anthony, you got a sweet little pop. But some of the people here could have probably helped me teach this. And there's much more than what I talked about, but to cram it into just a small amount of time, it's hard to do. But I'm happy to be here.
Oh, well, we'll have to do a Cannabis 102 class in the future. Well, guys, from my heart to yours, I hope you have a beautiful rest of your day. Happy New Year, and we hope to see you next time.
All right. Thanks, guys. See you later next time. Thanks, Lisa. Appreciate it. Tina?
Yeah, of course.
Tina, did you get my chat?